Hi, my name is Hannah James, and my research paper was about understanding the link between menstrual patterns and ACL tear susceptibility amongst female athletes. So, this topic is important to me and quite personal because I've had three ACL tears, and all of which have happened whilst I was on my period. And there's a lot of evidence about the two linked, and it's becoming more of a hot topic amongst professional clubs, especially in the soccer world. Um, yeah, so females are 10 times more likely to sustain an ACL tear compared to men. Okay, and this is backed up by research as well. Risk factors for this include biomechanics. Female biomechanics is a lot different compared to males. For example, we exhibit a greater hip adduction and internal rotation during landing and cutting, which increases valgus stress in the knees, so puts more stress on the knee joint itself, which can lead to injuries. Neuromuscular control too is a lot different. We females exhibit a delayed activation of the hamstring muscles, which is very important for dynamic movements such as running and cutting too. But the one that I want to talk to you about today is the hormonal influences, and we'll get into that a little bit further on in the presentation. So the importance of this, why? Because ACL tears, it's a very long recovery time, especially if you have surgery. Average is about a year, but it can take longer than that, and some people never return to sport, never return to the same level or even sport in general after the surgery. Second thing that's important is overall female health and performance. It's important to keep your athletes' healthy and healthy and safe so that they can play for longer. And of course, when you get to more professional matters, it can be quite costly to lose a best player, no matter what the sport is, to the success of your club or your team. And finally, is to try and find targeted interventions to help reduce ACL injury rates. Okay, so risk factors. First off, what is ACL? I'm going to be mentioning it a lot. So it's the anterior cruciate ligament. So you have four ligaments in your knee joint, as you can see from figure one on the PowerPoint here. The anterior is the one that's at the front, and the posterior cruciate ligament is the one at the back. So they are crossed like an X. And then we have two at the side, the lateral collateral ligament and the medial collateral ligament. Okay, but the ACL in particular connects the femur to the tibia. Okay, the function is it helps to stabilize the knee joint and it prevents excessive forward movement of the shin bone or the tibia. Okay, so that would be really important for dynamic movements like jumping and running. Okay, if it goes too far forward, then that will cause an ACL tear. Okay, so if you jump really awkwardly, I mean you land really awkwardly, or there's excessive force when you're cutting, that can cause an ACL tear. And what happens with that is you'll hear a popping noise, sometimes a little bit of a crunch if you tear other ligaments too, or damage bones, immediate pain and swelling, and instability within the knee. Um, Quite often it results in an operation, but if the tear is not that bad, then a bunch of physical therapy will just be okay, but you'll need a few months of physical therapy. So we'll give you a little basic background of the menstrual cycle. It's normally 28 days long, but it can vary amongst different individuals, can be 21 to 35 days, just depends. And there's four phases, as we can see in this figure here, okay? The first one is the menstrual phase. So that's basically the shedding of the uterus lining. And then the second phase is the follicular phase. So there is an increase in the follicle stimulating hormone. And there's also a little increase in estrogen, as you can see too on the graph. And estrogen helps promote the growth of tissues. So keep that in mind. The third phase is ovulation, which is the release of the egg. The final phase is the luteal phase, which is where the uterine lining thickens. Okay, so as we can see from this graph, the four most important hormones involved in the menstrual cycle is estrogen, progesterone, luteinizing hormone, or you can call that LH or LT, and follicle stimulating hormone, FSH. As you see, they peak at different parts of the cycle due to their different functions. So we'll start in the menstruation phase. As you can see, there's a decrease in estrogen and progesterone. Okay, so that would mean that we are a little bit weaker in our ligaments and tendons, connective tissues, that sort of stuff. And then in the follicle phase is when we're strongest. Okay, so this is when we start to increase in FSH, which causes an increase in production of estrogen. And then, like as I mentioned before, that will promote tissue repair and growth too. And then in ovulation, oh, we also, yeah. So in ovulation, as you see, is a quite a big decrease, a sudden decrease in estrogen and LH, and then progesterone starts to peak. It starts to increase a little bit and then peak into the luteal phase. Okay, so progesterone is um not very good for your ligaments. Okay, it makes your ligaments a bit lax. Okay, so which that will decrease the instability in your joints, therefore increase susceptibility to injuries. As you can see, this will be the weakest point in the cycle if you were to work out then, as we'll explain in the next slide. Okay, so how can we, um, as females, adapt to this in training? Okay, so a couple ways. Get my PowerPoint to work. There we go. Okay, so we can optimize performance and mitigate injury risk by maybe increasing intensity of our training in the follicular phase and then decrease in the luteal phase. Um, and also maybe we could introduce individualized programming. This is getting more and more popular amongst the national women's soccer teams. And sometimes they go as far as trying to synchronize the cycles of all the athletes in the squad so that they can um, all undergo the same intensities of training whilst yeah, so they can all peak at the same time. And obviously tracking is really important. Tracking your menstrual cycle is important to help develop these development programs, these individual development programs. So as a coach or an athlete, like what can be done? I think it's very important that to be educated about menstrual health. Okay, I know it can be a little bit awkward for males, but maybe it's time to break the stigma because there's lots of research behind this as a problem and the cost it could cause your team or career, for example. It's yeah, and athletes can regularly track their menstrual cycles, super easy via apps on your mobile phones. And also, I think it's important to incorporate health check-ins and discussions about menstrual health into team meetings to help break the stigma and make it just as normal as talking about um, like problems, like physical problems that's going on with your life too. Okay, so what does the literature say? You know, I've just mentioned it. A lot of literature states that there's a high correlation between it, but yeah, sometimes people say correlation doesn't mean causation, and at the minute, the studies don't say explicitly which cycle, like a specific cycle, causes ACL tears, because that would be a very hard study to that'll be a very hard study to do perform. Okay, so I'm just working on that. Okay, basically, literature states that the hormonal fluctuations affect proprioception and neuromuscular function. Okay, so for example, Gilchrist examined ACL incidents in relation to um, sorry, in relation to female soccer players. Okay, so and the results from that were that higher ACL incidence of injuries occurred during the luteal phase, just as we mentioned before, when progesterone levels are higher and ligaments are more lax. Okay, then Maya in 2014 did a study and concluded that ACL injuries were significantly more um, frequent during the luteal phase. Okay, and then as you can see, this is a to the side we have a direct quote from that. And then Grooms in 2015 also demonstrated that estrogen can affect ligament laxity too when there's really high elevated levels of estrogen, which therefore increases the risk of injury during that phase, during the phase when estrogen levels are particularly high. Okay, summary of the presentation and the paper. Hormonal fluctuations do influence ligament laxity, neuromuscular control, and joint stability, all in which affect susceptibility of female athletes to injuries. It's also important to educate athletes and coaches about menstrual health that will create a supportive environment and help break the stigma so that more research and we can be done and more protective measures can be taken place. Then also using this education to adjust training intensity based on menstrual phases is the way forward. And more sports teams are getting involved with this now. It's looking like the way to go. But I do have some more questions if I was to continue my research on this. For example, do certain contraceptives affect ACL injury risk across the menstrual cycle? Okay. What are the precise neuromuscular mechanisms altered by fluctuating hormone levels that lead to an increased injury risk? And finally, to what extent do psychosocial factors and menstrual symptoms contribute independently or synergistically to injury susceptibility? Okay, that's the end of my presentation. These are my references. Thank you for watching.